Good evening and welcome. You're watching the Newshour Agenda, the work from home edition. I am Padmaja Joshi. Just 5 days left when the official lockdown is about to get over. But from across the country, the concern is about the steep rise in the number of positive cases that we are hearing of, which is why several state governments seem to be inclined to extend the lockdown. And the people are also reconciled to the fact that this is in the greater good. Hotspots are being sealed off in an attempt to try and arrest that rise in numbers. But one state seems to stand out in terms of its statistics, and that state is Kerala, which so far hasn't seen too many casualties, thankfully. And there's even been the case of people who are elderly, who are in their 70s and 80s, fully recovering and managing to leave hospital despite testing positive. So what has Kerala done right? And what are the lessons that the state holds for the rest of the country? Because remember, this problem is not of any one state. It's a national problem, and the best practices can be emulated by everyone to ensure that we win this war. And to answer those questions and answer your questions, in fact, the best placed person right now is the Health Minister, Shailaja, who in fact led from the front in Kerala. Ma'am, thanks very much and congratulations for the kind of statistics, for the success that you have managed so far. Let me start by asking you, have you managed to flatten the curve?
Yes, we are trying to flatten the curve. And we can say that we have yielded good result on that. But it is not time to stop it completely. Our work should be continued and the vigilance should be continued. We cannot predict whether this virus withdrawed from our society or it is going through it because the novel coronavirus is like that. All of a sudden, sometimes it appear in somewhere in the community or society. We are eagerly waiting and we are eagerly looking for that whether there is a community spread or like that. We hope that there will not be community spread in Kerala because our preparedness is like that. We prepared well to fight this enemy and we are ready to fight this enemy and we are expecting the worst. And
can you name for us 2 or 3 best practices method. Because there are 2 models that are being spoken of right now. One is the Bhilwara model and one is the Kerala model. In Rajasthan, they did aggressive containment, entire areas put under curfew. What are the 1 or 2 things that you think worked for you in Kerala, considering that the first few cases positive were found in your state? And now you are on 7th or 8th number when it comes to the total number of positive cases.
Yes. Yes, our first case came from Wuhan, China. At that time when the virus occurred in China, we have to heard that news from the electronic media and other medias. At that time, we prepared ourselves to face that because we thought that people will come back from China. There are so many students studying in Wuhan University, and January 24th onwards we formed our control room, state control room, and a very good cell call center and like that. And we prepared everything. We have 18 expert group for each and every activities. And that thing, and we prepared our protocol and our standard operation practices and also advisories and guidelines for each and everything. And we asked our 14 districts to be aware and prepare themselves to face this contagious virus. And as we expected, January 30th, we had one positive case from Wuhan. And we isolated that case in our hospital. February 2nd and 3rd, we got 2 more cases. But at that time, all these 3 cases are under our surveillance and they were isolated in our hospitals so that no other transfer occur from them. That is our victory. And we didn't stop these works after that victory. After Wuhan, a few days, there was no spreading or no new cases. But at that time also we are working we are conducting some mock drills, etc. And we found that this virus is spreading throughout the world. And at last, WHO declared it as a pandemic. And so many peoples are returning from other countries to Kerala, throughout India, and especially in Kerala, more people returned here from Italy, UK, and also from Gulf countries.
Yes.
And because of our preparation, we were able to face that thing. Yes, that is the thing.
Okay, so one big takeaway, everyone is being aggressively screened, was aggressively screened, and the testing is also being done on a more widespread scale, which is interesting considering now ICMR has also revised its testing guidelines. Ma'am, a lot of people are very curious and they want to ask you questions. So if you could please take us a few viewer questions. We've got Nikki with us on the phone line from Mumbai. Nikki, please ask a brief question. Go on.
This is not about towards a ma'am. Hello, Padmaja, can you hear me?
Yes, go on, sir.
Okay, yeah. I just wanted to know when the lockdown will be open. The incidents of Jitendra Award happened. So people will be beaten first or treated first. What will happen? Just wanted to know that.
Okay, sir, thanks very much for your question. We'll just take that in a bit. Right now, we're taking questions specifically for the Health Minister of Kerala. I'll come back to your question in just a bit. We've got Mr. Sharma from Delhi. Yes, Mr. Sharma, what's your question?
Yeah, actually, Padmaja, I would like to ask Honorable Health Minister from Kerala.
Go on, please. Ask your question.
Yeah, actually, is she getting some special tips from China also, as they are both communist ruled states, and if there is some help.
Can we please not make this political or personal, sir? This is about getting the best practices. This is not the time for politics. Please, can I please request our viewers to ask specific questions? Ma'am, would you like to make a comment on why there was a sudden surge from Kasaragod? What were the reasons there, and how did you tackle that?
Yes, in Kasaragod, several peoples from Gulf countries returned back to their home, and we have a very good surveillance on them, and we quarantined them in home. More than 80% of the people obeyed our instructions, and they obeyed strict quarantine. But some people, not only in Kasaragod but also in Pathanamthitta, that Italy case and some Gulf case, some people didn't understand the curiosity or this what is this virus and what is the difficulties we are facing. They went outside, they jumped from the quarantine, and from that people so many contact cases occur. But at once we acted well, and we put all the peoples in quarantine again, and strict vigilance we had done there, and with the help of the local self-government and police, our Honorable Chief Minister have a very good plan and very good convergence of all the departments. And
Ma'am, do you also think that there was greater awareness because of higher literacy rate in Kerala, so the basic issue of social distancing was taken care of because public awareness was greater? Did that work in your favor?
Yes, yes, that is our blessing, you know. We can have very good awareness things among the people, and we have a very good campaign as breaking the chain, hand wash and hand hygiene, etc. Most of the people were obeying that things also, and social distance, etc. That is why this result. Otherwise, you think thousands of people returned from Dubai and other Gulf countries and from Italy and UK, and you know these R0 rates of this virus is 1.5 to 3.5, that from one person at least 4 can be infected, and the number will go higher if one travel among these people jumping from this quarantine, etc. But on that rate, our positive cases are very low, we can say. We have only 357 cases, out of which 99 up to 2 deaths happened and 97 cured. and now we have 258 cases. That is the thing. But in some pockets, some people mingled with other persons and some with their family members. That is why this primary contact occurred.
Now that you have a large number of people who are recovered and out, are you still keeping track of them? Because there is always the fear of second wave and some people being asymptomatic. How are you keeping track of people who have now tested negative or have seemingly recovered but have left for their houses?
Yes, we are insisting strict quarantine for at least 14 days. And if it is a high-risk case, we are insisting for 28 days. And we have a very good guideline and very good standard operating practices and very good protocol to identify which is the high-risk case and which is the normal case, etc. If any symptoms occur in the return Gulf or other people who came from abroad, if any symptoms occur, we directly take them to hospital and take the samples and send to virology lab. We have already more than 12,000 samples tested, and out of which only this 357 become positive and all other cases become negative. At first we have only one lab for testing, RT-PCR testing, and we request the center, government, GOI and the ICMR allowed us more labs. Now we have 10 labs. And the most important problem is that the scarcity of the testing kits, the RNA extraction kit and other reagents, etc. There is a scarcity. But we collected that thing wherever we can. We collected that things and we are testing. And that proper thing, that very good guidelines and very good protocol, we are testing the people who we suspected to have the virus in them. And in that case, we can yield good result. That is why the number become this. That on that way we can flatten the curve. Actually, our aim is to flatten.
Testing kits you say were a problem initially. Ma'am, do you have enough protective equipment, PPE? Is that an issue in Kerala? Doctor safety?
In the first stage, we have scarcity for that also, personal protection equipments and also N95 masks. That thing, the 2-layer, 3-layer masks we collected properly, but this thing, the companies were not supplying. We have got it for them, but they are not supplying. There is no stock, and nowadays also we feel some kind of scarcity for N95 and PP. But we collected from wherever we can. We collected the PP and N95, and our it is the most important thing is the safety of our health workers. We are giving proper N95 mask and this PPE to all the health workers who are going to nursing positive cases. That way it is sufficient. But if there is a surge, if there is a huge increase in the cases, number of cases, that time we also may feel some scarcity for this PP, etc.
Okay, ma'am, very quickly, I'll see if I can take a couple of more questions from our viewers. Ms. Nambiar, what's your question? And Deepak from Chennai. Deepak from Chennai, what's your question, sir? Please make it brief.
I just want to ask Ms. Shailaja about the treatment methods they did. Because Kerala is... Yeah, can you hear me? Yeah, I just want to know about the treatment methods they did in Kerala. Because Kerala is famous for traditional medicine.
Ma'am, was the line of treatment any different from what is being used across the country?
Yes. Yes. Yes, you all know, there is no proper medicine to contain this virus. And there is no proper prophylaxis, etc. But we are treating for the symptoms, you know. Throughout the world, we are implementing the same system, I think so. And our doctors also are giving medicine to this sore throat and other problems and respiratory problems, etc. We are treating. In one patient, we tried that ART also, and he survived. His condition was very severe. And at that time, with his permission, we tried ART also, and he survived. And that kind of treatment we are giving. And indigenous medicine also, we have a very good discussion among the experts of the indigenous medicine, especially Ayurveda, and we decided to give preventive medicines to people. If the immunity is great, more, and if a person is strong enough and proper immunity, and the attack of the virus will be less. And that way we are trying to have
Ma'am, that's a very interesting point. Could you elaborate on what indigenous medicine you are using
medicine for that
as a part of the line of treatment?
using for making, not the positive case. In positive cases we are not testing any medicine, and the very near contact, primary contact also we are not testing the medicine, indigenous medicine. But the people outside, we are trying to improve their immunity, and for that we are giving Ayurveda and other medicine to them. And also after the patients recover from this coronavirus, at that time also we are giving indigenous medicine to make them more healthy.
Okay, that's a very interesting point because that also is quite controversial, the use of indigenous medicine, whether it has any space in boosting immunity or in any way to help those who may be susceptible to coronavirus. But KK Shailaja, you have a success story on your hands. We hope it stays that way, and we're taking away important lessons for the entire country. For doing what you did, thank you very much. There's politics, but there's another time for that kind of politics. This, like we've been saying again and again, is the nation's war and not just one state. Thank you for winning one state for us. Thank you very much.